I strongly encourage you to support our hospital investing its funds in building a new emergency department for Culver City and Culver City's residents that directly impacts Culver City's residents' health. The worst of COVID is behind us. Now is not the time for the council to impose a financial burden on the hospital for a problem that no longer exists. You can do so by voting no on this oddly timed and duplicative pay ordinance, which impacts, I believe, only our hospital. I'm very concerned about this. I guess it's a government mandated premium pay for hospital employees. And it will negatively impact the hospital. And I'm afraid personally of it impacting our new emergency department and even the stroke certification process, which is arduous, long, and costs a lot of money.
Throughout this pandemic, hospitals like Southern California hospitals have gone above and beyond the pale to take care of not just patients, not just communities, but their staff. They've done things up to and including providing financial incentives to help alleviate their staff's personal burdens and ensure their safety. If passed, this ordinance will impact Southern California's ability to move forward on several fronts. Those fronts could include parking, expanding the emergency department, and trying to provide a stroke system that would allow members of the Culver City community to receive stroke services in the city of Culver City rather than having to leave. Southern California Hospital has been a positive and beneficial community member for Culver City for decades. We want that to continue. Please take a look at this ordinance. Please reconsider this ordinance. There has to be a better path to recognizing and honoring the employees of Southern California rather than an ordinance that is going to increase for a hospital that wants to take better care of the community.
We have an incredibly talented group of new orthopedic surgeons that have come on staff, and everyone's anxious to give care to the community. This would negatively impact our ability to do so because it would impact our ability to start at the stroke center in a timely manner and to renovate our emergency department. This bill, if it passed, would negatively impact our ability to take care of patients in our community. We have a new neurosurgical team that's backing up our stroke center, which we hope will be up and running shortly. And that way our patients don't have to be transported far away to get care for acute strokes.
I'm a trial lawyer, and I know how expensive litigation is. As a resident of the area, I hate to see taxpayer money or the hospital's money spent on litigation rather than on something productive for society. I'm sure the city has much more pressing and impactful ways to use its limited funds than on needless litigation. If adopted, this ordinance is sure to result in litigation by Southern California Hospital in the same way that similar ordinances for grocery store workers have resulted in litigation and even the closing of certain local grocery stores.